Let's be honest. Cats are masters of mystery. One minute they're purring in your lap. The next they're staring at a blank wall like they've seen a ghost. And because they can't talk, we often dismiss their strange behaviors as just, well, being a cat. But here's the hard truth. By the time a cat shows you they are sick, they have usually been hiding it for weeks. In the wild, a sick cat is a target for predators. So, your fluffy house panther is hardwired to suffer in silence. Today, I'm not talking about the cute quirks. I'm breaking down the 10 non-negotiable warning signs that your cat is screaming for help without making a sound. If you notice any of these, your cat isn't being dramatic. They are being desperate. Let's get into it. Sign 1, hiding in plain sight. Number 1, the sudden hermit. Cats sleep a lot, we know that. But there is a massive difference between a cat napping on the couch and a cat that has vanished off the face of the earth. If your social butterfly suddenly starts living under the bed, inside the closet, or behind the washing machine, this is not a personality change. This is survival mode. In the animal kingdom, when an animal feels vulnerable or in pain, they hide to protect themselves from predators. If your cat is isolating themselves from the family, especially from you, it often indicates severe pain, fever, or extreme stress. Don't just leave them alone because they seem comfortable. If they hide for more than 24 to 48 hours, it's time for a vet visit. Sign 2, the head pressing phenomenon. Number 2 is something a lot of owners mistake for a cat being sleepy or just resting their head. It is called head pressing. Look closely. If you see your cat pressing their forehead against a wall, a hard piece of furniture, or a corner, asterisk firmly asterisk without moving, this is not relaxing. This is not a cute sleeping position. Head pressing is a classic sign of a damaged nervous system. It can indicate a brain tumor, a stroke, or toxic poisoning. If you see your cat doing this, do not wait for a regular appointment. Do not book a checkup for next week. This is a veterinary emergency. Go to the ER now. Sign 3, changes in litter box habits. Number 3, the bathroom blunder. I know finding urine outside the litter box is frustrating. But before you get angry, understand this. Cats are obsessive about cleanliness. They want to use the box. If they stop, they aren't being spiteful. They are associating the box with pain. If a cat is straining to pee and only producing tiny drops, or crying while in the box, this is often a urinary blockage. This is especially critical in male cats. A blockage can kill a cat in 24 to 48 hours if the bladder ruptures. On the flip side, if you see large amounts of urine, it could be kidney disease or diabetes. And if you notice bloody stool or diarrhea outside the box, it's a sign of intestinal distress. Never punish a cat for missing the box. Instead, ask, why does it hurt to go in there? Sign 4, the third eyelid appearance. Number 4, the third eyelid. Cats have a hidden eyelid called the nictitating membrane. It usually stays retracted when they are awake. But if you start seeing that white or pink film creeping over the corner of their eyes, especially if it covers half the eye, your cat is in a state of severe unwellness. This is often a hallmark sign of Hawes syndrome, which is linked to gastrointestinal issues, or simply a sign of severe dehydration, weight loss, or systemic illness. If you see that third eyelid protruding, combine it with lethargy, that cat needs fluids and a diagnosis immediately. Sign 5, excessive drooling or bad breath. Number 5, the drool myth. A lot of people think a drooling cat is just a happy cat, like a dog. That's usually false. While some cats drool when they are extremely relaxed, sudden or excessive drooling is a red flag. Saliva is a response to nausea or pain. If your cat is drooling, they might have ingested a toxin, like lilies in a vase, which are fatal to cats, or they are suffering from severe dental disease. Look inside their mouth if you can. If the gums are bright red, or if you smell a foul odor, that's stomatitis or rotting teeth. Dental pain is excruciating for cats and can lead to them stopping eating entirely. Sign 6, rapid breathing or open mouth breathing. Number 6, breathing blues. Here is a golden rule: dogs pant. Cats do not pant. Asterisk asterisk. If your cat is sitting still, not after a play session, and they have their mouth open, tongue out, breathing rapidly, this is not them cooling off. This is respiratory distress. It could be asthma, fluid in the lungs, often from heart failure, or a chest tumor. Also, watch their sides. If you see their belly moving in and out aggressively with each breath, we call this abdominal breathing. It means they are struggling to get oxygen. If you see blue or pale gums along with this is a life or death situation. Do not wait. Sign 7. Changes in vocalization. Number 7. The silent scream or the midnight yowl. Listen to your cat's voice. If your quiet cat suddenly starts yowling, especially at night, or if your chatty cat has gone completely silent, pay attention. Excessive yowling in older cats is often a sign of hyperthyroidism, an overactive thyroid, or high blood pressure. Can also indicate cognitive dysfunction, cat dementia. They get lost in the house and cry out because they are confused. Conversely, a cat that stops meowing entirely might be in too much pain to expend the energy to speak. A change in the quality of the meow, making it hoarse or weak, is also a classic sign of an upper respiratory infection or throat issues. Sign 8. Lack of grooming, the messy cat. Number 8. The unkempt look. Cats spend 30 to 50% of their day grooming. It is a natural, automatic behavior. So, when a cat stops grooming, it's a massive deal. If your cat starts looking greasy, develops mats, or smells bad, it's usually because they are in too much pain to twist and bend. Arthritis is the number 1 culprit here, especially in older cats. They want to clean, but their joints hurt too much. Alternatively, obesity prevents cats from reaching certain spots. But don't just label them lazy. A lack of grooming is a direct sign of physical pain. If they look like they haven't showered in a month, they are telling you they hurt. Sign 9 and 10. Appetite and aggression. Number 9 is the obvious one. Appetite changes. But it's not just not eating. If a cat stops eating for even 24 to 48 hours, they are at risk for hepatic lipidosis, fatty liver disease. Their body starts shutting down. If they are eating more than usual but losing weight, that's diabetes or hyperthyroidism. And number 10, sudden aggression. If your sweet lap cat suddenly turns into a hissing, swatting demon when you try to pet them, they are not being mean. They are in pain. This is the most common sign of referred pain. If they have a toothache or back pain, and you touch them, they lash out because they can't tell you it hurts right here. If their personality changes like a light switch, assume physical pain first. The summary. Alright, let's wrap this up. If you take nothing else away from this video, remember this: cats are stoic survivors. They will not limp unless the bone is broken. They will not cry unless the pain is unbearable. To summarize the 10 signs: 1. Hiding from the family. 2. Head pressing against walls. 3. Litter box issues. 4. The third eyelid showing. 5. Drooling or bad breath. 6. Panting or heavy breathing. 7. Vocalization changes, yowling or silence. 8. Lack of grooming, greasy coat. 9. Appetite swings up or down. 10. Sudden aggression. If you notice even one of these, don't wait. Don't say, "I'll see how they are tomorrow." Cats deteriorate fast. If you are worried enough to Google it, you are worried enough to call the vet. If you found this helpful, please hit that like button to help other cat parents see this. It might save a life. Subscribe for more cat care insights. And as always, give your feline friend a gentle pat from me. Thanks for watching. I'll see you in the next one.